The Faris Virani Ewing Sarcoma Center is a comprehensive center that includes both clinical care of patients with Ewing sarcoma and then bench-to-bedside research for discovering new things about Ewing sarcoma to advance our treatments.
So Ewing sarcoma is a relatively rare cancer or malignancy that typically affects pediatric patients, usually towards the teenager range of patients or adolescents. It's a tumor that forms within the bone or sometimes soft tissue or muscle area.
Patients will present with just pain. Oftentimes Ewing sarcoma happens in the arms or legs, so children will come in with just a little bit of pain. Sometimes there may be swelling at the site of the tumor, but a lot of times there's very minimal signs and symptoms. Like all cancers, Ewing sarcoma needs to be diagnosed on biopsy so that we can get a piece of the tumor and look at it under the microscope and see what it looks like and do specialized tests on it. But from the beginning, all of the children will have imaging studies, either x-rays or CT scans, to give us an idea of how involved the tumor is. The length of treatment for Ewing sarcoma typically is about 9 to 10 months, which includes the chemotherapy, either surgery, radiation, and then another block of chemotherapy. And then once they're completed with the upfront treatment for Ewing sarcoma, the oncology team follows them for another 5 years to make sure that the tumor has not recurred. And then once they're done with that 5-year follow-up, we actually have a long-term survivor clinic where they're transferred to and they're followed for life. The incidence rate of Ewing sarcoma in the United States is about 250 cases are diagnosed every year. And then at Texas Children's, being the largest cancer center in the United States, we see about 8 to 12 patients every year that have a new diagnosis of Ewing sarcoma.
One of the major emphasis or focuses of the Faris Virani Ewing Sarcoma Center is really advancing our research goals or endeavors. And some of the exciting research projects that we are actively working on within the center include really understanding the basic biology of the disease of the tumors and hopefully through that integrating it towards clinical care. One of our focuses is understanding how do these cells, these Ewing sarcoma cells, metastasize, and by understanding that process better can we then understand or devise better therapies. In addition, we're also trying to look at other aspects including cells known as cancer stem cells. So these are some of believed to be cells that are involved in the actual tumor development or initiation. And so if we can understand these very early on or initial cells that are within the tumor, again, understanding the biology of these tumors, some of the genetics of these tumor cells, can we devise better ways to treat them? And other things we're looking at as well includes understanding biomarkers. How can we have ways or means to earlier on understand whether a patient may respond to our therapies that we're going to be giving him or her? We're also doing things really trying to push the envelope and looking at novel things such as immunotherapy approaches towards the treatment of Ewing sarcoma. This is where using some of the patient's own immune system, such as their white cells and immune cells, to help fight the cancer. We really want to make every patient and their families who come through the door feel like they are the only patient being treated here at Texas Children's. We want to be able to provide comprehensive physical as well as emotional care for all the patients and their families. And I think here at Texas Children's we can offer all those resources for the care of these patients.
Our patient care coordinators are unique in that they are there from the very beginning at our diagnosis, and they help be an advocate and ambassador for the patient and the family and help them through the journey that is the treatment of cancer.
The fact that we can offer precision medicine to each individual patient that walks in the door. And what I mean by precision medicine is the fact that we can take a piece of the patient's tumor and personalize it towards understanding its biology and genetics to hopefully gain some insights into that individual patient's characteristics and their tumor characteristics, such that ideally down the road we can translate that to, again, helping with our personalized care for each individual patient. So there's a couple ways to contact us. One way is through our website, www.txch.org, and you can look up treatment centers, and under treatment centers link tab, there's actually information about the Ewing sarcoma center here.
Parents can reach our center by calling 832-822-4102, or they can call 1-800-CANCER-9.